Parents are dealing with changing vaccine recommendations. People insured through one kind of Blue Cross Blue Shield of Kansas plan are learning about changes to their health care, too.
Elise Schoenig covers the cost of health care for us here at 41. After her dedicated coverage on this topic, a patient reached out to her with some concerns.
Some patients insured through a certain kind of Blue Cross Blue Shield of Kansas plan reached out to us after they say they learned their preferred providers were no longer in network at the KU Health System. I'm Elise Schoenig, and I cover the cost of health care. We followed up with some of these impacted patients and learned what consumers in any situation like this should do.
My husband had a regular routine follow-up appointment at the beginning of January, and when he was signing in through the KU Health portal, it said that he would owe like $500.
Amanda Storm says her health care is caught in the crossfire. She reached out to KSHB 41 after her husband's doctor appointment. That's when she says she learned her insurance no longer covered her family's preferred providers.
It is one of the few plans that, as a self-employed person, both my husband and I myself are self-employed, that we could purchase.
Her $3,000 a month plan used to cover her doctors at the KU Health System, but she says she learned after open enrollment ended that would not be the case this year.
We don't really know what our options are.
In emailed statements, a Blue Cross Blue Shield of Kansas spokesperson said the changes were effective January 1st, adding they, quote, remain disappointed in the decision of the University of Kansas Health System to terminate their contract. And a KU Health System spokesperson said in part, quote, this is extremely disappointing for us, but most importantly for our patients, and that they are, quote, working directly with patients to transition their care, end quote.
There's been a number of cases over the last 15 or so years of insurers and healthcare providers bumping heads on terms of their agreement.
Barbara Zabawa is an associate professor of law with UMKC. She says consumers deserve thorough communication with these kinds of changes.
Well, the consumer is kind of a third party, right? They are the ones that have to bear the decisions, the consequences of the decisions made at the negotiating table.
The consumer, the patient, is caught in between.
Storm still has lots of questions.
I am not surprised that we've fallen through the healthcare crack.
And she says she's stuck without those answers. Elise Schoenig, KSHB 41 News.
Okay, so what should consumers take from Storm's story? Always read the fine print when enrolling in health insurance every year and ask questions from your insurance provider.
So if this does happen to you and you're in the middle of treatment, talk to your provider. Also, the law professor you heard from that story says the insurance commissioner's office in Kansas is there for consumer protection, so you can reach out there as well.